Welcome back to another episode of Aspirations, career advice for your life. My name is Mina Sleeb. I'm again joined by my co-host, Georgina Khalil. And today we're speaking with another professional who's going to give us insight into their career, their journey, and how you could potentially follow in their footsteps. Who do we have on today?
Today we have Myrna Sidaros. Hi, Myrna.
Hey.
Can you introduce yourself to the audience?
Sure. My name is Myrna Sidaros. I'm in my second year of graduate school for speech-language pathology. I'm here with you guys today.
Awesome. Well, thank you very much for being here. Can you give us some insight into speech pathology? What is it?
Speech pathologists usually treat and assess any communication disorder. So we work with patients who have voice disorders, have fluency disorders, cognitive or social disorders, expressive or receptive language. So it's very broad, but we do work with different populations as well. We work with early intervention, we work with pediatrics and older populations as well. So it's very broad and you can work in different settings with different populations.
Very cool.
And Myrna, can you tell us when did you know you wanted to be a speech therapist?
Sure. I wanted to become a speech therapist when I was in my freshman year of college. I was going for my education degree and I observed one of the speech pathologists at my school and I fell in love with working with kids because it's not a routine job. You work on different goals for each child and each child has specific goals towards their path. And I fell in love because it's very different. You do something different every day. Every child has their own needs and you assess them towards their needs. So that's something that I fell in love with.
I love that. And you mentioned you're in your last year of your master's program. Do you need a master's to get into your field? Can you just have a bachelor's? Can you just talk through like the requirements to actually get into this?
Sure. So you do need 4 years of undergrad. If you want to become a speech pathologist, you have to do your master's. So your master's usually 2 years, and then you take your boards exams, and then you do your clinical fellowship. Some states you can work as a speech pathologist assistant, and you wouldn't need your master's, but to become a fully certified speech pathologist, you do need your master's.
So just to confirm something here, so a speech therapist is a speech pathologist. It's
Correct.
the same thing.
Yeah.
Okay. And
I had that same question. So
yeah, me
thanks.
too. So can you describe how your day-to-day looks like?
Sure. Right now I'm doing my placement with the older population, so I'm doing it in a hospital setting. We work with a lot of patients who have Parkinson's disease, if they have TBI, strokes. So we work with a lot of, also that's another aspect of our scope of practice. We do work with patients who have swallowing disorders. So people who usually get out of strokes could have dysphagia, which is a swallowing disorder, and we're there to assist them treat the disorder as well. So as part of my daily work, I see patients who have strokes, who have Parkinson's, who have dysarthria, TBI as I mentioned. So I'm working with the older population where voice disorders as well. And that's it. We go in, look at the schedule, we time manage. You have to be very good with time management. And you see the patients throughout the day, write your notes, what you did with each patient, and that's what I'm doing currently in my placement.
So you could decide, after you're done, you could decide to get into working with children versus adults, right? You can specialize in a specific age demographic or demographic in general?
Yeah, correct. The beauty of your master is that you do your placements in different settings. So you do your placement in a hospital setting to see if you're interested in working with the older population, and then you do your placement with pediatrics. So you can be in a school setting or a private clinic or an agency to see which population you want to work with. So it gives you a chance, it opens your eyes to more than one population. It's not only one path that you can take. And that's also the beauty of speech pathology, that you can work with different populations at the same time on your own time.
That's very cool.
Interesting. And do you think there's a demand for this job?
Oh, absolutely, yeah. There's always demand for speech pathology. and it's been growing throughout the years now because it's becoming more popular. But it's a very competitive field because everyone in speech pathology know each other.
Yeah.
So
Okay.
you have, during your schooling, you have to maintain a very high GPA.
What would you say? What's that number you have to maintain?
It depends on what school you go to, but for graduate school, they say to keep it above 3.5. Okay. So you have to have above 3.5, and you have to take your GREs also. Some schools require it now for graduate school.
Okay. Well, good to know. That's high. I don't know if I would have stayed in, but you know. So tell us a little bit about the salary, right? Like everybody's wondering, you know, how much can I make in this career? Should I, you know, does this fit the lifestyle I want? So can you give us like an entry salary and then kind of like an upward bound of what somebody can expect?
Sure. It ranges from 85K to, you can go up to 100K plus. It depends on how many certifications you have, if you're a bilingual SLP or not. These things play a big factor in your salary as well. So the more certifications, the more salary you're gonna have. Right. But the good thing about speech that once you're done with your clinical fellowship, you don't have to go back to school. You're done.
Oh, great.
You can improve your resume by adding more certifications, but you would be done with schooling.
So it's not like those doctors who have a different test every month.
No. Yeah, the path is usually 6 years and then it's over. There are some programs now that offer 5 years, undergrad with grad together, but it's usually around 6 years, and then once you're done, after your master's, you take your boards exams, and then you do your clinical fellowship, and then you're certified.
Great. And I'm curious to know, what is one thing do you like about your job and one thing that you dislike about your job?
I love working with kids, and I feel like it's very rewarding. It's rewarding with older people and with kids, but I feel like it's very good to see a child expressing themselves for the first time in front of their parents. You see the joy in the parents' eyes, and you feel that, okay, I made a child express themselves, and it's very rewarding. I would say right now, because grad school is crazy, I think one thing that I dislike is time management, because as a speech pathologist, you're gonna have a lot of either kids or patients on your caseload, so you have to be really good at time managing, because it will affect your quality if you're not good with that.
Yeah, that makes sense. And so last question, what would you say, do you think that you can really serve God in this career? If so, how can you?
I feel like in this career specifically, yes.
Yeah.
Because if you're working, well, in every population, you are going to be serving God. You have to be very passionate about what you're doing. If you're not giving it your best and you're not passionate about it, you're not going to feel the rewarding outcome. Serving God, yes, when you help someone in front of you, being able to express their mind, they're being able to say what they've been wanting to say, they've been even able to eat when they're not able to eat with the older population. It's very rewarding, and you feel like you're serving God's people. And the same way when you're treating kids, for example, kids with special needs, it's also very rewarding, because you can bring it back to your community by sharing awareness and saying, hey, listen, like, it's okay to accept people, it's okay to talk about this, it's very rewarding in that sense.
Yeah, also in our community, it's a little taboo if somebody's having speech difficulties and things like this, right? Yes. So like helping them overcome something that, especially in a community that might not even understand what somebody's going through, and could see how it's very rewarding.
Yeah, in our Egyptian community, it's like you said, it's very taboo to talk about this, and parents usually don't feel so comfortable if their child is struggling or having some difficulties, either with speech or cognitive disabilities. Right. Our role is to give that comfort to the parents and say it's okay, and we love our kids, and we want to see the best coming out of them. So I think it's very rewarding in that sense, that you can open people's eyes of accepting each other more.
Thank you so much for being here and sharing all this information with us.
Yeah, we really appreciate it. Thank you for taking the time, and giving us kind of an in-depth view into speech pathology. And we want to thank all our viewers for joining us today for another episode of Aspirations. Subscribe, like the channel, like this video, and check us out for another episode coming your way very soon. God bless.